Hello and welcome. On the day of the Janta curfew, we cheered our health workers on the front line of the fight against coronavirus with claps, with talis and with thalis, as they rightly deserved it. But today, our health workers are increasingly at risk from the virus and they need more than symbolic support. There are no official figures for how many health workers have been infected, but an NDTV estimate suggests that it may be as high as 69. And there are reports of fresh cases of infections of health workers coming in every day. From Mumbai, most recently, where two private hospitals, Wockhardt and Jaslok, have been turned into containment zones because at Wockhardt Hospital, around 26 nurses and 3 doctors have tested positive. At Jaslok, the hospital says at least 1 nurse has tested positive so far. At least 34 doctors have tested positive for the virus in the national capital, reports the Indian Express. Now, these rising numbers have intensified questions over whether India's medical workers have enough safety wear or not. More and more doctors are facing a backlash for going public with claims that they are falling short of safety wear. The latest to join an ever-growing list, Telangana. This is a letter, an SOS from the Telangana Doctors Association. They are seeking a public donation for safety wear, for gloves and masks and so on. Safdarjung Hospital, one of Delhi's top government hospitals, put out this unusual appeal recently. This is an SOS from Safdarjung saying they need safety wear. An unusual appeal from a top hospital saying we're in dire need of hazmat suits. On the evening of the same day, the hospital administration issued a letter cracking down. It said that hospital WhatsApp groups, the administrators will be subject to police scrutiny. The admin details will have to be shared with the police, which led some to ask whether the top hospital, Safdarjung, is attempting to stifle whistleblowing. At the All India Institute of Medical Sciences too, there's been friction over the quality of safety wear. About 10 days ago, the AIIMS resident doctors, again unusually, issued a tender for safety wear. This is the procurement letter, the SOS from AIIMS, where they went public with a bid for safety wear, again masks and gloves and so on. It's unclear if these demands were met, but some days ago, a former AIIMS staffer went public with an image of what he claimed was of poor quality safety wear in the hospital, taken supposedly by a serving doctor. The image, reportedly clicked a few days ago in AIIMS' emergency area, shows a doctor getting into a blue protective gown assisted by his colleagues ahead of conducting screening for COVID virus. The helpers seem to be securing the blue suit with tape, a kind of jugaad approach which doctors say is unsafe. What they need are all-encompassing, disposable hazmat suits. But all of this doesn't seem to have gone down well with the AIIMS administration, leading to the AIIMS Resident Doctors Association protesting, writing an open letter to the Prime Minister. The AIIMS doctors say that they are facing a backlash. In fact, they say they're facing a harsh backlash for speaking out. It's the responsibility of the government, they write, to ensure that the soldiers, as the government has called them, are heard. AIIMS today issued a circular issuing N95 masks for all healthcare workers involved in direct patient care, not just those treating COVID cases. The only catch? They have to disinfect and reuse these masks for at least 4 times on their own, in which case they say the same mask can be used for 20 days. Okay, now as far as the government is concerned, they say that all is well with the availability of safety gear. The Health Ministry in a statement April 6 says that 1.7 lakh personal protective equipment or PPE has been donated by China that has arrived. 20,000 PPE they've got from domestic suppliers or domestic companies. 3.87 lakh PPE is already available. 20 lakh N95 masks have been supplied by the government. And orders for 2.6 crores coveralls and masks imported have been placed. And the priority, they say, is to send all of this to hotspot states like Maharashtra, Kerala and so on, and to central hospitals like AIIMS and so on and so forth. So we fact check this because there seems to be a moving of goalposts between yesterday's statement and a March 30th statement where they also outlined how they were getting PPE. So on March 30th, they said that 3 lakh PPE will be donated by April 4th. But in yesterday's statement, only 1.7 lakh, just about half, has come in by April 6th. On March 30th, they said 11 Indian companies will be making about 50,000 PPE a week. On April 6th, they say only 20,000 have come from Indian firms in the past week. On March 30th, the government said they'd ordered 30 lakh PPE from Singapore and South Korea. On April 6th, that number has jumped to 2.6 crore PPEs, which they say they're importing from Singapore, no mention of Korea and China. So again, many questions over what's the real state of the availability and the numbers when it comes to safety wear in India. Joining us tonight on the show, we have Dr. Srinivas, MD, who is General Secretary of the Resident Doctors Association of AIIMS. We have with us Dr. Upendra Kaul, Chairman, Batra Heart Centre. We have with us also Sanjeev Relhan, who's the head of the Preventive Wear Manufacturers Association. Let me just start with you, Dr. Srinivas. Now, AIIMS has come out very strongly and said that you are facing a backlash because you're speaking about the lack of safety wear. But the government keeps saying that there is enough safety wear. What's the truth?
I would like to clarify that the state of preparedness of AIIMS is far better than the hospitals all over the country.
Okay.
And our feedbacks are being addressed on a daily basis.
Okay.
But issues still remain. So let us not be bashing the government or the administration for the works they do. But issues still remain. So that is a clarification from my side. And as you have pointed out in the multiple data and controversial remarks made by the government,
yes,
with the data and the kind of availability, the concern still remains because India was late to respond to the crisis that was visible to most of us in the form of news and other information available.
Okay.
Our preparedness is inadequate, and the kind of suits provided to doctors doesn't inspire confidence both in AIIMS and outside.
Let's look at that picture again, actually. If you can put up that picture of that suit supposedly taken in the AIIMS sort of the emergency area, a very jugaad kind of a suit which is being put together with tape and so on and so forth. Now, what is the problem with that exactly? Dr. Srinivas.
So, to protect from COVID-19 virus, a proper suit called the hazmat suit has to be provided in most of the areas where doctors are exposed to the risk of the virus. But such suits don't offer the adequate protection a proper suit is supposed to provide. So this is an arrangement before the government actually steps in the supply. But how long can we wait before the proper suits are available for all the doctors deployed in the screening area? So this
and also now they say that they're giving you N95 masks to everybody, not just those who are in the COVID containment areas, but they're saying that you have to reuse it 4 times and run that for 20 days. Is that realistic?
It is going to pose an occupational hazard because doctors cannot take an infected mask back home. So there should be a proper advisory from the administration and the hospital infection control committee about how this is going to take place at all, if that has to be the case.
Right.
So the advisory from CDC and FDA was for the peak pandemic time when N95 cannot be sourced and the logistics cannot be managed. But seeing the situation, such a situation is happening just even before the peak pandemic is reached. It is very concerning.
It is concerning. But Dr. Kaul, now, from your own experience, I mean, firstly at Batra, I'm not sure if Batra itself is, taking in any COVID cases or any of that, or perhaps you've created a, safety zone there. But how are you doing with safety wear as a private hospital? Are you in a better place?
Yeah, we have created a safety zone, and at present we're not admitting the COVID patients, but we're in the line in case we're required. Right now, only 3 private hospitals are, open for private patients, but sooner or later, and as you can see, the numbers are increasing. In Delhi also the numbers are increasing. So we are trying to get these, but as you rightly said, they're in shortage. And I'm a cardiologist, and we have to be in the cath lab. And any patient who requires urgent angiography, although we minimize it, only in those patients where it's a life-saving kind of a procedure, we take them. But we need to have for one procedure at least, at least 4 of these PPEs, unless we know that the patient is, free of COVID. And for finding out whether the patient is free or not, it takes time these days, because at present we don't have rapid, tests available. So that report comes next day. So we have to assume that these emergency patients may have COVID, and we have to take all the precautions. And one of the most important things is these PPEs, because the personnel, doctors, the nurses, they cannot observe, the distance, because we have to come close to the patient while taking the history, while examining the patient, while performing a procedure on the patient. So they're extremely important, but they are actually in short supply, whether because of this genuine supply shortage, there is some hoarding, and the people
and there's also been
bigger stocks. So there are some problems, and
there has been a problem, and there's also been
a large number of these things.
There's also been delays. There has been significant delays by the government in ordering it. We extensively reported on it. I'll refer to that a little later. But let me just go across also now to Dr. Rajesh Parekh, Director Medical Research at Jaslok Hospital, which, as we said, is also now kind of gone into a lockdown. Now, Dr. Parekh, what exactly happened at Jaslok? Firstly, just to understand, your statement says only 1 nurse has tested positive. Is that right? Because some media reports suggested the number could be higher.
Yeah, it is slightly higher. But if you want the chronology of events, I'll go through it very quickly.
So before you come to the chronology, I just want to know what's the number of those tested positive in Jaslok?
3. I said 3.
Oh, sorry, I missed that. You said 3? Okay.
Yes. So may I?
Yes. Do go ahead and do explain also what happened, because again there's this kind of concern about whether hospitals have done enough to protect medical staff from getting infected.
Okay. So I think this example will amply illustrate that no matter how well prepared you are, you're still vulnerable. In the last week of January, I had a talk with our CEO, Mr. Jitendra Haryan, and our COO, Mr. George Alex, cautioning them to the possibility that we would be faced with the situation that we are facing today. On the 7th of February, I addressed a directors meeting at Jaslok and highlighted to them the possibility of such an eventuality. We started preparing a protocol. It's an extensive 50-page protocol. We then started training our staff, and we did a few dry runs to make sure things work well. And we've been COVID ready for quite some time now. Now, also built into the protocol was just come Plan B.
Yeah, sorry, I don't want to cut you short, but we are a bit short on time. If you could just come to the current instance, and what exactly happened in this case? I believe it was someone who was a heart patient who'd come in.
That's exactly what I was doing. I cannot talk about our patients out of respect for confidentiality for them, but I can talk to you about ourselves. And as I was telling you, our contingency plan was for the eventuality that we are facing, that what if a patient tests positive? What if our staff tests positive? What do we do? We had set aside an entire floor, the 12th floor, for COVID-19 patients. We had ordered our hazmat suits, we had our ventilators, we had our training, everything in place. Despite that, and we have our testing in place. So we've tested everybody, and we found a couple of nurses positive, and more as a precaution For our other patients, some of whom are immunocompromised, we discharge patients who didn't need to stay. We requested staff over the age of 60 not to come in. So I think your words were right. It's an apparent partial lockdown. It's not a complete lockdown.
Okay, but just to understand, I mean, without compromising the patient's privacy, it's still unclear how did your staff get exposed? I mean, if they were taking all due precautions, how did they get infected?
We don't know. I mean, they could have got infected outside the hospital. We really don't know. You must understand, Srinivas. You must understand, Srinivas, we are dealing with a completely new beast. Our understanding of this virus and how it infects people is considerable, but yet very limited.
Okay.
So you cannot predict with any accuracy.
I was led to believe that it was a patient with a different ailment. But anyway, you're saying it could be even someone from outside. But
or it could be a patient. I don't know.
It could be a patient.
We don't know.
Okay. Sanjeev Relhan, Preventive Manufacturers Association. Now, what exactly is the position with with this safety wear? Because the government keeps putting out, as we said, these huge numbers that we are getting lakhs from here, crores from there. But in actual terms, and we reported this, that the government they started placing orders very late, almost towards the end of May. By then the lockdown had set in. Number two, most of the orders were to Indian manufacturers, just about a dozen or so, who can only produce 6,000 to 7,000 units a day. Now they seem to have pivoted and said we are going to import everything. It's all, forget make in India, it's all going to come in from China and all of that. So what's going on?
Yes, sir. Exactly. If we talk about this lockdown, it has affected a lot. And of course, yes, we are also seeing that government is working, as far as I can understand, that Ministry of Health and Ministry of Textiles are taking some steps to import, and our only focus is even if it is imported, it is available, it is good, because we cannot put the healthcare workers' safety at stake.
Right.
There are some clarifications which would have changed the scenario, like in Ministry of Health and Family Welfare guidelines about rational use of PPE, wherein they have actually not mentioned any PPE for people who are doing the odd jobs like screening and quarantine patients.
Yeah.
If they could have come up with some guidelines of a gown kind of thing which can provide a basic protection,
right,
we could have saved lots of panic, because then these hazmat suits were not required to all of them.
Okay, so they're saying it could have been specified for certain categories of doctors.
Yes.
But it's not just doctors and doctors associations and hospitals which are saying there's a shortage. State governments are also saying that there is a shortage. And I spoke earlier to T.S. Singh Deo, who's the Health Minister of Chhattisgarh, and I began by asking him that is there a shortage of safety wear in Chhattisgarh, and has the centre promised you safety wear which is not reached? Let's listen.
Thank you first for having me with you, Srinivasanji. And the fact is that the centre adopted a very conservative protocol regarding testing right from the beginning. And if the number of tests were to be few, then the requirements of PPE kits or other requirements like testing kits would naturally be fewer. And following that protocol, they had not given apparently that priority to larger number of either testing kits or PPE kits to be manufactured.
Okay.
Once this pressure came out from the states that we need more and more testing, and we started from one testing center in Pune, now we have 170 odd. So obviously when testing increases, the PPE kits required for taking samples to taking part in the procedure of testing in the laboratory to the patient care. Then there were threefold requirements of PPE kits at 3 points.
Okay.
That obviously the center, I think, did not take that into account.
So you are falling short then, in other words?
When the crunch comes, we'll be short. Today we are just about making it, scraping it through. If a major requirement comes about, we will be short of kits. We ordered 14,000 kits in 2 batches from the 3rd of March onwards.
Right.
And they were able to supply only 2,000. So obviously we are short, and this gives a negative message in the district centers,
right,
where then the doctors and nurses and the testing people, they become insecure that if the kits are not there, then how will we test? We may get infected, etc.
Okay, so when you said that you ordered a big amount and they supplied you very little, by they you mean the government agency, which is this HHL Healthcare. That's the one you're referring to.
Yes, the HLL, which is the Government of India subsidiary, and the Government of India was controlling the supply, how much to give to which state.
Right.
So through the process, there has been a conservative mistake.
Okay, so how are you making up the shortfall then, sir? Are you buying from the open market, or what are you doing?
We had kept ourselves open, buying in the open market. The limitation is that the material supplied should conform to the WHO or the ICMR standards.
Right.
If it does not conform to those standards, then the people doing the testing, they are knowledgeable. So they straight away say that we are not willing to use these kits. So that is the crunch.
Okay.
We must have enough. Today we are just about scraping through. But
Okay.
we are not seeing today. We are planning for tomorrow when a very large number comes. And for that, supplies have to be there. We placed orders, for example, we are taking out a tender for 2.5 lakh PPE kits.
Right. Okay. Well, we wish you all the best, and we do hope the supplies increase. Thanks very much indeed. Also spoken earlier to Sanjay Kumar, who's Principal Health Secretary Bihar, to explain how bad the shortage is in Bihar. This was an interview done a few days ago. Let's listen.
That's already in the public domain. In fact, what is our immediate requirements are personal protection equipments, what goes by the name of PPE. Then we need N95 masks, and we need the RNA extraction kits and the VTM. So these are of immediate, and the 3-ply masks also. I think where we have short supply is in PPE, and in N95 are comparatively little better, but PPP remains a challenge for us. So that we are trying to, we've been making requests to HLL also. We have requested them for 5 lakh kits, and we have till date got about 4,000. But we are also looking at other sources across the country for suppliers who may provide us PPE kits at this our time of absolutely dire needs, I would say. I guess there is a supply chain challenge across the country, and all of us who are part of the health system, we are all pulling in, and we are trying to do how best we can get over it.
Okay, so clearly a shortage there. Now, of course, state governments can speak out openly and say there's a problem. But Dr. Srinivas, now, when all of you speak up, do you face any pressure from the government or anyone else?
I think
any
the
pressure?
The very fact that I'm able to appear still on TV is that the AIIMS administration is still open. But we are more concerned about other hospitals in Delhi and elsewhere who are facing this backlash. Our administration has been very receptive.
Okay.
I would say there are concerns, but they are being addressed. The major issue is about other hospitals, as you have seen about notices and kind of personal vindication and doctors were speaking up.
And of course, the other worry is that there's this kind of social ostracism, stigma, where what we're playing is a viral video, of this doctor in a Surat civil hospital. When she came back home, her neighbors were shouting at her. They were trying to attack her. Just terrible, and the complete opposite of all that huge amount of national support for our doctors. And then this is the result. But anyway, we hope that it's going to change, and that the supplies of safety wear will increase for our frontline workers. Thank you all so much for joining us.